Good afternoon, everybody at home. Thank you for tuning in. I hope you have a chance to go outside today. It's another beautiful spring day. I want to thank you for tuning in today and remind you that tomorrow we'll be back to our regular 1 o'clock slot. We will begin, as we always do, by taking a quick look at the data. We continue to see a plateau. Today, there's another 209 cases. It was better yesterday when the number started with a 1, so we're not yet on that solid decline, but we're in a very stable place, and we have been for a couple of weeks now. So that is good news. Very unfortunately, another 6 deaths. It's a reminder to all of us that, every time I get up here and I say X number more cases, X number more deaths, there's a person behind that number. It means somebody's lost a loved one. It means hundreds of our friends and family are sick, often very sick. So let's just try to remember that and keep that in mind as we go through our daily lives, that this is a very deadly virus. And even though we're in an excellent place and in a plateau, there's a lot of human suffering behind it. And I want us all to be conscious of that. Some good news. Yesterday, I announced that we launched our Crush COVID app. It's a one-stop app to help us deal with the crisis. In less than 24 hours, more than 10,000 Rhode Islanders have downloaded the app. That's fantastic. One day, 10% of our population. So please, if you haven't downloaded the Crush COVID ID app, 1%, not all the little kids will sign up. Crush COVID app, please do it. It'll take you 5 seconds and it'll help you. A lot of people have said they like it. It's convenient. You're learning a lot of information. Go ahead and download it. I want to get back up here tomorrow and say we're at 20,000. So take a second, Apple Store, Google Play, download it. Memorial Day. Monday is, of course, Memorial Day. It's a big and special weekend here in Rhode Island. It's the unofficial beginning of summertime. I have to say, summer is my favorite season. It's my favorite time of the year to be a Rhode Islander. My family and I love to go to the beach and go fishing and do everything there is to do in Rhode Island in the summer. So to remind you, on Monday, on Memorial Day, we'll have 2 state beaches open, East Matunic Beach and Scarborough Beach, as well as all of our state parks. Goddard Park, Rocky Point, all of the state parks will be open for the weekend, and the 2 beaches will be open on Monday. Now, we felt it was important to have some opening of beaches as a symbol. It's a symbol that we have to carry on our lives. Memorial Day is important. Memorial Day is a time when we have an annual tradition in Rhode Island of going to the beach. But I want to remind you, in some ways, it is a symbolic opening. You don't have to pay for parking. There's going to be very limited parking, no lifeguards, no concession stands, no showers, no bathrooms are open. So it's if you want to go for a walk or you want to go for a run or just sit on the beach for a little while, go ahead. It's supposed to be a great weekend, but please don't congregate. Don't stay too long. No big groups. We still have the limit of 5 on social gatherings. To that point, I know another big tradition on Memorial Day is getting together, having a barbecue. Everybody has a cookout on Memorial Day. It's a time for family and friends to get together, and it's going to be a beautiful day. I just have to remind you, the limit on social gatherings is 5. That this is going to be hard. I can hear you complaining now. I can hear my own family complaining now. The limit on social gatherings is 5 people. This weekend is not a weekend to throw a big party. It is not a weekend to have a big barbecue. Get together in a small group, enjoy your family, go for a walk, go to the beach for a walk. Keep the social gatherings to a limit. If you don't do that, then 2 or 3 weeks from now, we're going to see a problem. If you have big Memorial Day blowouts this weekend with lots of people congregating, not wearing masks, not being socially distant, then 2 or 3 weeks from now, we're going to see a spike in hospitalizations. And we don't want to see that because we have tens of thousands of Rhode Islanders out of work right now. Their lives are brutal. They are out of work. Restaurants are closed. Retailers are closed. And I got to get them back to work. And so our ability to get our friends and family back to work depends on us doing the right thing, which means keeping social gatherings to a limit of 5, even on a holiday weekend. So I'm asking you please to hang in there, have fun, enjoy the weekend, but do it in a small group, in a socially distant way, wearing a mask and washing your hands. I know that sounds like a lot of fun, but please do it because it's the best thing to do for Rhode Island so we can get out of here, get out of this crisis and get back to work. I also, and I should say this, people are wondering how long do we have to live like this? On Friday of this week, I'm going to be talking about what phase 2 looks like. You know, we're trying to get to phase 2, as I said, in early June, hopefully the 1st of June. So this Friday, I'm going to be giving some sense of when we'll get to phase 2 and what phase 2 will look like. I hope to give you the light at the end of the tunnel, but in the meantime, hang in there with me a little longer so we can really crush COVID and safely get everybody back to work. While we're talking about Memorial Day, it is very important that we pause and remember what Memorial Day is all about. Although it's a time to go to the beach and have a barbecue, that's not what the day is about. The day is about remembering the fallen Americans who have served in defense of our country and remembering their families who have lost a loved one. It's a day to remember and thank all of our servicemen and women for their service, protecting us, keeping us free, and keeping us safe, and their loved ones who support them. To that end, on Monday, I will not be having this press conference. I instead will be doing a video message in recognition of the fact that it is a solemn and special day. We also will be having a ceremony, a Memorial Day ceremony at the Veterans Memorial Cemetery in Exeter. We do that every year. This year it'll be primarily virtual, so it's a primarily virtual ceremony, but we're gonna make it special and we are gonna televise the ceremony and we are going to mark this solemn and special occasion because that's the right thing to do. And I would ask every Rhode Islander to find some time on Monday to express your gratitude to our veterans. Figure out how to do it. Thank a veteran, donate to a veterans organization, tune in to the cemetery, the ceremony at the cemetery. You know, just figure out a way to show your support and your respect and your gratitude for the sacrifices of the men and women in the armed forces. Obviously this year, you know, in addition to the fact that we have many members of the National Guard deployed overseas, we have almost 1,000 Guardsmen and women here deployed in Rhode Island, doing contact tracing and testing, delivering meals, disinfecting nursing homes, keeping folks safe in the veterans home. They're on the front lines of this every day. And so I want to say thank you to all of our National Guard men and women for being so awesome and passionate and professional from day one of this crisis. This morning, my husband Andy and I began our morning with General Callahan and his wife Donna Callahan on a phone call with the Family Readiness Group and the deployed leadership of the 115th Military Police Company. This is one of our companies of the Rhode Island National Guard that are deployed. These soldiers are currently deployed to Southwest Asia, and we were able to get an update. The temperature there when we talked to them was 105 degrees. These are folks who have been away from their families for months. They range in age from 19 to 53. There are people who are our friends and family, our neighbors, our Rhode Islanders who are deployed in Southwest Asia, away from their families, while many of them have families and children back here dealing with COVID-19. So I have a special message to the soldiers who are deployed, which is on behalf of Rhode Island, thank you, and we're proud of you. I received the update this morning. I know it's a difficult mission. You're doing a fantastic job, and I want to thank you for that. I want you to know we are keeping your family safe. It's hard. It is hard. Your kids are being homeschooled. Your spouses are holding down the fort like they never have before, but they're strong and they're getting it done. To the families who are here providing support to your soldiers who are far away, what you are doing is unprecedented. Dealing with the challenges of COVID, the unemployment that some of you are facing, homeschooling your kids while your spouse is away, a lot of you have your own challenges. It doesn't get harder than this. But when I talked to you this morning on the phone, I came away energized, inspired, and just ready to go. So I want you to know we're here for you. We will support you. We will support your soldiers when they come home. And you just keep at it. You are doing great. You just keep at it one day at a time, supporting your family, supporting Rhode Island, and supporting your soldiers abroad. And we are so grateful. And I also want to say thank you to General Callahan, Major General Callahan and his wife, Donna. They are true servant leaders. They are leading their troops and the families through making sure that they are taken care of. So on behalf of a grateful Rhode Island, to the Rhode Island National Guard, thank you. A couple more announcements. I want to talk for a minute about healthcare. During the first phase of reopening, I cannot say this enough. If you need to get healthcare, you need to see your doctor, you need an immunization, you need a non-critical surgery or a test or a diagnostic or cancer treatment, please go get that service. I know a lot of you have put it off. We have seen a 30 to 40% decline in child immunizations. That is a real problem. Please call your children's pediatrician, primary care physician, and go ahead and get your kids immunized. If you put off an elective surgery and the hospital has reached out to you to reschedule, please go ahead and reschedule and feel safe to go to the hospital and get that non-critical surgery. If you're a cancer patient who's afraid to go get your therapy and you've been putting it off, please go ahead and schedule the appointment and get your treatment. It's safe to do it. We wouldn't have reopened hospitals if it weren't safe. Dr. Alexander Scott and I are in touch daily with hospitals all around the state. They are prepared. They have fantastic infection control protocols. These are professionals. And at this point, it's not safe for you to keep putting off this healthcare. So I know you're afraid. I want you to get the courage to go see the doctor, have your children seen, have them immunized, have the confidence to know it's a safe thing to do, and go ahead and see your doctor or get the test or get the surgery that you need. We are seeing declines everywhere, declines in our emergency room, declines in primary care offices, declines throughout our healthcare system. And we really have to work together to go ahead and go see our doctor if we need to. To that point, I want to give Rhode Islanders some assurance that we, the state, is going to do our part to continue to strengthen our healthcare system. On account of the great work of our federal delegation, we have received $1.25 billion in COVID emergency relief funds. And we will be using a portion of that fund to invest in our healthcare system. We're going to be investing in all of our hospitals so they can be strong and so they can get through this crisis. all the lifespan hospitals, Care New England, Charter Care, Fatima Hospital, South County, Westerly, all of them. We're going to try to shore them up to get them through it. The same for pediatricians in primary care. The same for our nursing homes. You know, we really want to continue to support our healthcare system so they get through it and they have what they need in order to support your needs. We also, I want to tell you, we've seen excellent uptake in telemedicine. I hope a lot of the changes we're seeing now through COVID, I think and I hope are going to stick. They're going to stick with us. And telemedicine is one of the, I'd say, positive changes of what we're seeing, which is to say sometimes you can get excellent level of care on the phone or through video. And so we're seeing a nice uptick in that. I want to encourage that, and I want to thank all of our providers for adapting, patients for adapting, frankly, our insurance companies for paying for it. It's the right thing to do, and I want to encourage you to think about continuing to do that even after the crisis, because it's going to be important. I want to talk for a minute about churches. It's a topic on the minds of many, and it's been a very difficult couple of months without being able to worship in our synagogues or churches or mosques or other places of worship. Many very important holidays have come and gone, and we have had to have our faith-based communities and services done virtually, which is something, but it doesn't cut it, and it's not the same thing. As I announced on Monday, we are targeting the weekend of May 30th for the reopening of places of worship. And I, again, have to say a huge thank you. I put together a small working group advisory board of faith-based leaders. They've been working with us daily to help us get to this place. Monsignor Kenny, Bishop Nisley, Bishop Jeff Williams, Rabbi Mack, Reverend Nagira, Imam Ikram, and several others. I want to thank you. I should say that this has been difficult. Even within this group and within the larger advisory group, it's been hard to drive a consensus. What we have come to as a general consensus is reopening the weekend of May 30th with significant capacity restrictions, and houses of worship will be limited to 25% of their overall capacity. 25% of their overall capacity. Now, I want to say a few things. First of all, 25% is a maximum. That is the maximum that you can start with. I have heard from many faith-based leaders that they're not going to do that. They just don't feel comfortable. They're going to keep it to gatherings of 5, 10, or 20. And I support that. That is your decision, and you should do what you think is in the best interest of your congregation. Others of you, I think, would like to go to above 25%, and that we cannot support, not now. The whole name of the game now is slow and steady. If you go above 25% too soon, too many people will get sick and we'll have to pull back. So 25% is where we came out as a beginning. There will be many other restrictions, and later this week on the Reopening RI website, we will have detailed explanation of the other requirements, though you know what they're going to be. Mask wearing, no physical contact, 6 feet between people, 6 feet between folks, and any kind of a line that might happen in the church, etc. Proper cleaning. But I have been asked to give some notice on the 25%, so folks can start to get their houses of worship ready. And later this week, as soon as we can, we'll get the full list out there. But again, I want to thank all the faith leaders. It's not easy. This is not going to be easy. We're going to have to adapt together. And for those of you who still feel that you're not ready, then take your time. The best thing to do is to take your time. Last thing I want to say on places of worship, please do not go if you are sick. That is very important. You know, at the end of the day, I'm trusting the people of Rhode Island to do the right thing. If you are a senior, if you have an underlying health condition, if you are frail, you really need to think hard about whether going to a place of worship, going anywhere, is the right move for you right now. If you are sick in any way with any symptoms, please do not go. The risk is too high, and we've come too far in dealing with this crisis to go backwards. So the Department of Health asked that I particularly emphasize that message, and I am, and I'm asking for your cooperation. The final note is I just wanted to remind everybody about the town hall that we're having tomorrow at 11 a.m. Tomorrow at 11 a.m. I'm going to be hosting a Facebook Live for older Rhode Islanders and their families. I'll be joined by HHS Secretary Wilmazetta Jones. I would encourage you, if you are an older Rhode Islander, to tune in. Lots of questions that you have, we'll try to answer them. Also, we need to hear from you. This entire exercise that we're about to go through for the next year until we have a vaccine is going to be about a two-way dialogue where we together are flexible and creative and agile and innovative. So if you can, I'd encourage you to tune in tomorrow at 11. You could send us your questions in advance, communications@governor.ri.gov. Let us know what's on your mind, and I look forward to seeing everybody tomorrow at 11. So I'll turn it over to Nicole and then come back.
Thank you, Governor. Good afternoon, everyone. Thank you for being flexible and joining us at 2:30 today to get the latest updates. As usual, I will start with an overview of the numbers for today. We have 209 new COVID-19 cases to report. There are 257 patients who are currently hospitalized. Of those 257, 58 are currently in the intensive care unit, and 45 of those 58 in the ICU are currently on a ventilator. Sadly, we have 6 additional COVID-19 associated fatalities to report. 2 people were in their 80s and 4 people were in their 90s. Our hearts are with the families of these people who we have lost and with the families of all Rhode Islanders who have passed away over the last several weeks and months. The numbers I announced today are posted on our data page on the Rhode Island Department of Health website, along with updated city and town information and additional demographics data updated, which we will continue to maintain regularly. These numbers had not been updated online for a brief period of time because we were doing a big data migration from a traditional disease tracking database to one with the capacity to respond to our expanded current needs. This system will allow us to integrate many different functions that we were managing into one system. For example, in this one system, we will be able to do case investigations, contact tracing, symptom monitoring, and outreach to people in quarantine who need support. This new database will allow many more people to access and work with the data simultaneously so that we can become increasingly effective and rapid in our response, as we are intending to do every single day. We needed to expand this capacity given that we have dozens and sometimes more than 100 people working with the data simultaneously in order to effectively manage the cases of more than 13,000 people who have tested positive in Rhode Island, as well as the contacts that we are working with to help them all stay safe. I want to thank everyone across state government, and particularly at the Rhode Island Department of Health, who worked very hard to help us move from one system to the other. The governor mentioned the technology support team earlier this week. All of us have been partnering working diligently to update this data and continue to make sure we are able to respond to the increasing needs of this response. I also want to thank the team in our Center for Vital Records at the Rhode Island Department of Health. Using records such as birth certificates and marriage licenses, we were able to fill in a lot of gaps on race and ethnicity for a lot of the records. This continues to be our laser-focused priority, to really make sure we have the information in one place that allows us to analyze and be pinpointed in our response. A tremendous amount of work has gone into pulling that together. We were able to get race and ethnicity information added for about roughly 1,000 people through this mechanism, along with the many other components we have been using to cull this important information. As I've said in the past, this race and ethnicity data is key to our response and key to ensuring that we support everyone throughout the state, particularly the communities disproportionately impacted. In terms of the trends that you will see updated, things have unfortunately not changed drastically. We continue to see more cases, higher percents of cases among Latino Rhode Islanders, as well as an elevated percent of cases and hospitalizations occurring among African American Rhode Islanders. The fatality percentages, however, are a little closer to what we would expect to see in alignment with the percent of those races and ethnicities across Rhode Island. I did want to note that our overall number of reported cases rose by a little more than 1%. That roughly 1% of cases has been distributed over the last 2 months. This was because of the data cleaning that we did over the course of this transition between the two systems. When you're gathering information on something as large and as fast moving as a pandemic, this kind of data cleaning and validation is ongoing. We have tested well over 100,000 people, and we have the tens of thousands of cases that we have, and it requires extensive attention to detail, data cleaning, and validation that has led to that slight increase by the 1% that we will continue to ensure remains accurate for everyone. We also have updated now the information by cities and towns. And it's important to acknowledge that we continue to see high rates in the cities most impacted. Central Falls has a 26% positivity, Providence 22% positivity, North Providence 18% positivity, Pawtucket 17% positivity, and Woonsocket as well. This information just helps us emphasize the fact that we have our work cut out before us. This is what we are laser focused on addressing with the data following, and we will continue to update and assess this regularly as it informs the response that we want to be most effective in addressing, particularly for our communities most disproportionately impacted. To finish, I'll return to the updates about the Crush COVID app that we discussed yesterday. And as the governor shared, we had the number of people across Rhode Island who have now installed the app. I have done that as well. We are very excited about the engagement and hope that we can continue to see people upload the app and obtain the information that's needed, continuing to follow the opportunity for you to make the choice as you need to. As I was asked yesterday if the app allows the Department of Health or anyone else to see where people are in real time, I want to again clarify that this technology is not about locating people in real time. It is meant as an electronic log of the places that you have been in the past, and we only know that you were in a place in the past if you decided to provide that information to us. As the governor mentioned yesterday, it will only then just continue to live on your phone. And everyone has the opportunity to determine how they want that data to be handled. We understand that people have privacy concerns. We take that very seriously. And please know that the only information that is shared with us is the information that you choose to share. If you do choose to share the information with us, it will only be used to help keep you and the people around you healthy and safe. That's something that the Department of Health has had experience with for years and continues to take that responsibility with honor and handle accordingly. It's all part of the response as we go forward. So with that, let's get started with questions. Thank you.
Governor, do you expect communion will still be allowed in Christian churches? And also, I know there's still capacity limits, but is there any difference for weddings and funerals within a house of worship? And how could that
Great
go?
questions. So we do expect communion. Communion, in the Catholic faith, there is no mass without communion. So that's very important. So yes is the answer. You highlight why this is a little complicated and why we've had so many discussions. In different faiths, there are different traditions. Many of them involve being close, having communion. There will not be the cup, the precious blood, but there will be the host. And there'll be all kinds of regulations around that. The answer to your other question is no, those would, any mass, a funeral is a mass, a wedding is a mass, so all of those services, any service that would be a service in a house of worship would be according to the same new rules, which is 25%.
Governor, on the churches, just to stay on that for a second, you talk a lot about your own faith. Can you kind of walk us through your process for whether you'll actually go to church, and then also specifically at your church, if you run into a situation where there are a lot of people there, I mean, are you going to check ahead of time to see how many people are going, things like that?
Yeah, okay. So my family and I are Catholic, and our church is St. Raymond's in Providence on North Main Street. We have been celebrating Mass virtually. Pastor Peroni's been fabulous. He has it on Facebook every Sunday. And to his credit, he's been telegraphing to parishioners. He said last week he spent the whole time marking out 6 feet distances. He has caution tape everywhere, that they're going to take it seriously, which is terrific. We will go. Yes, I will go, assuming I'm not sick and my kids aren't sick, but assuming we don't have any symptoms. I plan to start going to Mass again. I plan to just follow the rules. We will wear a mask. We will bring hand sanitizer. And we'll follow the rules. So I'll probably, if we were to get sick, I would say, obviously I wouldn't go. I'm probably going to suggest that I will suggest to her that she not do it. We'll see how that goes. But that's how our family will handle it.
Governor, Rhode Island is 25%. Massachusetts is 40% capacity. Are they being too aggressive, or are we being too conservative?
It's a judgment call. It is really a judgment call. The answer is, I think there's no right answer. No one has ever done that. No governor has ever had to do this. So we're all doing our best. And I respect Governor Baker. I think he's doing an excellent job. How did I come up with 25%? Through a lot of conversations with faith-based leaders. And by the way, it is high. That is a high number. If you think of, say, the cathedral, St. Peter and Paul, or you think of a large synagogue, they can hold maybe 1,000 people. So this is a big deal, allowing a couple of hundred people in one place. So how did I get comfortable? I'm relying on the faith-based leaders to do everything possible to keep their congregants safe. There's some people who say, Governor, it's hundreds of people. It's true. But I trust the priests and rabbis and imams to do the right thing and follow the rules.
One of the guidelines is limited singing. Do you take that personally?
I do not take that personally. I have
I have a question about Memorial Day. I was reading how your dad served our country in World War II, Joseph Raimondo, on the USS Amsterdam. And I also read how your father was very involved volunteering with scouting.
Yeah.
I'm just curious if some of the things you learned from him, you've implemented during this crisis.
No, thank you, and thank you for asking about him. He passed away 6 years ago, last Saturday, so he's been on my mind. Yeah, my dad was a World War II vet. He was part of that greatest generation. A highlight of his life was serving the country in the Navy. He left Mount Pleasant High School a year early to volunteer, like so many folks did, to serve their country, and then went back later and got his degree from Mount Pleasant High School. Yeah, I think about him all the time, and service is really what it's all about. You know, this is a hard time for so many Rhode Islanders, and I'm just trying to serve, you know, and in a way that I'm not comparing what we are doing to serving in the Second World War, but, you know, right now I'm running a big operation and I'm leading a lot of people in the National Guard, in state service, leading people to try to serve the people of Rhode Island, making a lot of mistakes as we go, but that commitment to service is something we can learn from every veteran. I think especially those World War II vets. I mean, they laid it all on the line and were so humble, and I think we can all learn from them.
Governor, there's at least one live music venue.
Okay, hang on.
Sorry, one at a time. Bill and then Michael.
We're gonna do you again.
Hi, Governor. There's at least one live music venue in the state that's already announced that they're returning to business on June 12th. Would guidance around religious services be similar to what a live music venue should apply? You've got people singing in space. Are you looking to do something like that, 25% capacity? Do you see similarities there? And what's your message to a venue that's announcing that their schedule is back on effective June 12th?
Yeah. So that's a risk to do that because they may or may not be allowed to do that. We'll be in phase 2 then. And I fully expect in phase 2, we'll be having indoor dining and, you know, some amount of, a lot more commerce. But whether or not that would be allowed, it's very likely it won't be allowed. So I wouldn't be making those promises because chances are, or it could be, you're going to not be allowed to do that. And if you do, then we're going to have to enforce the rules and not allow it. No, I think a music venue is quite different than a church or a synagogue. And the way we're thinking about it, we have endless hours of conversation trying to think of how to get it right. So, you know, a church can be a more controlled environment, and there's someone presiding over the environment. It's limited in time, and there's a pretty good ability to keep people apart. Concert, it's harder. I mean, you know, it's just hard to enforce social distancing in a music venue. Now, indoors is much more dangerous than outdoors. So we look at indoors versus outdoors. But the real thing is, can you enforce social distancing? Can you reasonably be expected to enforce social distancing? You know, and will everyone wear a mask? Can you turn folks away if they don't have a mask? Can you, you know, actually keep people 6 feet apart? And that's how we're going to think about it.
They would be allowed to, if they, what I saw was that this particular venue indicated that they would take those steps that you just described. Are they? I
don't know what the venue is, so I don't want to speculate. But listen, I can't make policy on the basis of what one venue is willing to do. We're looking at, you know, across the board, is it reasonable to think that in every bar, for example, they will enforce social distancing? And like an example of bars, I think the answer is no, because folks congregate at the bar. So we're going to take it a venue at a time, at least in phase 2. For phase 3, we're looking more along the lines of just guidelines and then asking people to follow the guidelines. But phase 2 is still going to be like a setting by setting set of guidance until we're a little further along. I'm sorry.
Governor, you talked extensively about veterans in Memorial Day and ceremonies and services. There have been news reports that the federal government is limiting deployments to 89 days so that National Guard troops who are active and deployed are not reaching the 90-day threshold to qualify for benefits in the case of otherwise. Does that affect Rhode Island National Guard troops, and what is your reaction to that?
Yeah, I hadn't followed that closely, so I don't want to talk about a hypothetical. If it is as you described, that's obviously disturbing. I mean, that isn't something that I would be supportive of, but I have to look into it and get back to you.
Governor, I understand that the National Guard checkpoints at the airports and the highways have been disbanded. Why make the decision to disband them now when people could be coming into the state for the beaches, snowbirds coming in from out of state? Why now?
Yeah, so a couple reasons. One, because there was not much work to do. To be very honest, it's a resource allocation. I need to allocate resources, including the National Guard, to where we need them. We need them a lot more now with contact tracing than at the border. At the time I decided to disband them, which I think was a week or two ago, the numbers were absolutely negligible. I mean, we were deploying resources to stop a couple of cars a day, so it just didn't make sense. Also, for phase 2, there'll be different and more relaxed limits around travel. I haven't yet decided exactly what they will be, but you can imagine that they'll be more relaxed and that kind of a thing wouldn't be necessary. So that was really just a resource. We're constantly evaluating where do we deploy people in the best, highest use.
And on churches, because there are going to be new requirements, just like for small businesses to, put in social distancing measures and clean, any thoughts about giving financial assistance to churches to help them with these efforts?
It's not something we're considering right now. I will say this, everyone is struggling right now. And we're going to do everything we can to help everyone on an individual basis. If we can give somebody a hand, if they're struggling, we'll do everything we can, but that's not really on the agenda.
Governor, after talking with people in the performing arts community, they feel a little left in the dark, left out of the conversation. Could you address that community and give sort of insight on when they can allow for in-person dance classes, that sort of thing, youth theaters this summer?
So some of it, certainly for the summer camp, for those performing arts that want to have summer camp, I hope they do it and they can follow the summer camp guidance, which is to begin on June 29th. So the dance classes and such, consider that, music classes. For the rest of it, I'm just going to ask you to wait a few more days or until Friday or early next week. That'll be part of the phase 2 discussion, and I'll have more to say then. But let me say, I hear you. I mean, look where we are. PPAC, I mean, we're here. It's tough. It's sad that they haven't been able to operate their business, and we're going to try to get them back into business as soon as we can.
And those centers hold their recital here at the Bats. Do you see allowing something like this, an audience spread out?
At some point in time, yes. That's what we're working through right now. It's all back to the question I answered here, like, do we have confidence that there can be effective social distancing at a statewide level? And that's what we're trying to work through.
Governor, you're talking about resuming religious services with restrictions for the weekend of May 30th. But some religions, particularly Judaism and Islam, will begin their observances the prior day, May 29th, because it's a Friday. Is that included the weekend?
Saturday is the weekend.
Governor, a group of the restaurants have got together, a coalition, and apparently they're pushing for a June 1st deadline as far as inside dining.
I'm trying to get there.
Okay.
I'd like to get there.
But
It's very reasonable ask,
okay.
and we are working. Just give me a little more time. I'm trying to get there.
With that, either you or Dr. Scott, how much does air conditioning affect the virus? We've seen the display where there's one person sitting, and then as soon as the mask comes off because of the air conditioning, it can spread, and that's why the outside dining is so much more effective. How much does, in lack of a better word, but the virus love air conditioning and a ceiling and walls?
What's beneficial in combating the virus is being able to have access to adequate airflow that happens most naturally outside, where it can be disseminated as opposed to lingering. If you're inside and there is poor ventilation or not a lot of airflow, particularly natural airflow, then it is more likely for the virus to hang around as people cough or sneeze without having some form of cloth face covering over their mouth and nose. So it's really why each element of what we're discussing is a critical piece to helping us stop transmission. Having air conditioning set up and being able to allow for airflow, preferably with windows open, and most beneficially outside, minimizes the chances that someone would be exposed by lingering viral particles in the air.
Now, doctor, you're infectious disease.
Yes.
I mean, how confident would you be about going inside dining? Because on hearing that, I'm not confident about going inside or anything. And maybe we should just think more about heat lamps. And it seems the more you're outside, the better your chances to not contract the virus.
Science is definitely showing that to us, and this has been such a dynamic process. It's why infectious disease is considered one of the best specialties in my mind, because you're always learning, and there's constantly emerging information that is occurring. Being able to really follow those rules and have the clear understanding that there is public health guidance and science behind them helps lead to me feeling more comfortable in those situations. It's why we really are encouraging the cloth face covering, some form of ability to prevent the virus from protruding even with normal conversation. The additional 6 feet distance also helps do that. The additional frequent environmental cleaning also makes a difference. So when you have each of those elements in place, it significantly decreases the risk of transmission. And the more everyone understands that and the more everyone follows the rules, the better we can be in going forward, because we have to live. We have to be able to engage in activities that will support our economy. And our focus is to be able to do it as safely as possible and adjust to the science as we go forward.
You know, Governor Raimondo's going to go back to church. Not to get too personal, but are you also planning on going to a house of worship?
Yes, the faith community and faith is very important to me and to our family. So very much look forward to continuing that engagement.
Dr. Alexander Scott, do you have an updated number on the long-term care deaths? And conversely, do you know of the 538 fatalities, how many of those people would have been considered healthy Rhode Islanders without underlying conditions?
That's a number that we are continuing to assess. It's somewhat challenging sometimes to be able to get that in detail because of the different ways that the unfortunate deaths occur. But by and large, most individuals who have passed away, unfortunately, have some form of underlying illness or are of an older age that sets them up. We are less commonly seeing people who were previously healthy with no underlying illness and no risk factors pass away.
Doctor, I think there's been some questions about air conditioning because people have an understanding that some types of illnesses are associated with air conditioning, like Legionnaires' disease. Can you distinguish that sort of situation from this?
Yes, yes. Legionnaire's disease is a bacterial infection that is associated with a particular water source that contributes to its dissemination and risk of infection. That's different from this viral illness that's transmitted by droplet and has a different approach in how people are infected. I wanted to finish with answering your question about the unfortunate fatalities that have occurred. 6 of the ones announced today were associated with either an assisted living facility or a nursing home, and we'll be happy to provide additional data to you on that.
Thank you, everyone. We'll be back tomorrow.